Alright, so I decided to do a brochure for my patient education project on sickle cell anemia. And bear with me. I do not have a printer currently available, so I'm giving my summary on a laptop. The target population for my patient education project is an African American population, due to them being the most susceptible to sickle cell anemia. Sickle cell anemia was originally found in African Americans. It was a genetic adaptation used to help them fight off malaria. A little bit behind the etiology of sickle cell anemia. Sickle cell anemia is present at birth and is inherited when a child receives two sickle cell genes from both parents. The cause of sickle cell anemia is a mutation in the gene that communicates to your body to make hemoglobin. And hemoglobin is a protein in red blood cells that carries oxygen throughout the body. The abnormal hemoglobin makes the red blood cells a sickle or crescent shape. A few of the signs and symptoms of sickle cell anemia. With anemia, you're going to have a lack of oxygen to the body, and this is going to cause fatigue, drowsiness. You'll have episodes of pain with sickle cell anemia, swelling in the hands and feet, frequent infections, inhibited growth or puberty, and issues with vision. And these signs and symptoms can be seen in patients as early as 5 months. There are some pretty serious complications that come with sickle cell anemia. This is due to the blockage or slowing of blood flow and oxygen to the body. And some of these major complications are stroke, acute chest syndrome, pulmonary hypertension, organ damage, blindness, leg ulcers, gallstones, and pregnancy complications. There are a few treatment options for sickle cell anemia, but the only cure currently is a bone marrow transplant, and this is pretty rare due to patients with sickle cell anemia being too old, or they can't find a donor who's a good enough match for them. Blood transfusions may also be used to treat and prevent complications that can occur with sickle cell anemia. And there are some oral medications that patients can take that have sickle cell anemia. Some of these are some pretty big names, so I'll just read off a few of these. Voxelotor, it's an oral medication that prevents red blood cells from becoming sickle-shaped and sticking together. Penicillin is common in children with sickle cell anemia. If taken 2 times a day, this has been shown to reduce the chance of children having severe infection. Prevention of sickle cell anemia, there's limited prevention strategies because it's an inherited trait. So if you have a partner who has sickle cell anemia and you have sickle cell anemia, you should seek a genetic counselor before trying to conceive children. The counselor will be able to tell you potential risks and the available options for reproduction. A few special considerations for athletes. You should know your sickle cell trait status. Take appropriate amount of rest and recovery in between sets and reps during training. And you shouldn't go into training at an intense level. It should be a slow progression. And you should avoid maximal exertion longer than 2 minutes without rest during training as well. If you experience symptoms such as pain, abdominal weakness, fatigue, and the feeling of being out of breath, and you have sickle cell anemia, you should go to your athletic trainer or coach immediately. Proper hydration is essential with sickle cell anemia. You should avoid hot and humid climates along with high altitude. And ultimately, all athletes should avoid drinking caffeine when they're participating in athletics, but sickle cell anemia patients should avoid caffeine because it can contribute to dehydration. And I am a Pittsburgh Steelers fan. About 13 years ago, there was a player um, playing. They were playing the Denver Broncos. His name is Ryan Clark. He's a safety and has sickle cell trait. And he had a severe reaction after the game due to the high altitudes. The reaction basically attacked his spleen, and he had to have his spleen and gallbladder removed. And the next time the Pittsburgh Steelers played in Denver, he sat on the sidelines. So this is an example of some of the consequences, but also precautions that athletes with sickle cell anemia need to consider. Something unexpected that I found while doing my research is just how many professional athletes have sickle cell anemia. I always thought sickle cell anemia was something that limited your athletic ability, and I didn't realize there's some really athletic athletes and really good athletes that have sickle cell anemia. So this just goes to show that just because you have this disease doesn't mean you can't perform at a high level.